Selegiline is a monoamine oxidase inhibitor used to treat major depressive disorder and Parkinson's. In this video, let's found. What is Selegiline? What is Selegiline used for? Contraindication. What are the side effects of taking Selegiline? How does Selegiline work? How to use Selegiline? What is Selegiline? Selegiline, also known as Eldepryl and sold under the brand names Eldepryl and Emsam among others, is a medication which is used in the treatment of Parkinson's disease and major depressive disorder. It is provided in the form of a capsule or tablet taken by mouth or orally disintegrating tablets taken on the tongue for Parkinson's disease and as a patch applied to skin for depression. Selegiline acts as a monoamine oxidase inhibitor and increases levels of monoamine neurotransmitters in the brain. What is Selegiline used for? Monotherapy for initial treatment of Parkinson's disease, as well as an adjunct therapy in patients with a decreased response to levodopa/carbidopa. Also used for the palliative treatment of mild to moderate Alzheimer's disease and at higher doses, for the treatment of depression. Contraindication. Do not take Selegiline if you have used narcotic pain medicines, including meperidine, methadone, tramadol, demerol, dolofen, Ultram, or an MAO inhibitor, MAOI, e.g., isocarboxazid, linezolid, phenelzyne, tranylcypromine, Marplan, Nardil, Parnate, Zyvox, within the past 14 days. Side effects. Side effects of the tablet form in conjunction with levodopa include, in decreasing order of frequency, nausea, hallucinations, confusion, depression, loss of balance, insomnia, increased involuntary movements, agitation, slow or irregular heart rate, delusions, hypertension or increased angina pectoris, and syncope. Most of the side effects are due to a high dopamine signaling, and can be alleviated by reducing the dose of levodopa. The main side effects of the patch form for depression include application site reactions, insomnia, diarrhea, and sore throat. The Selegiline carries a black box warning about a possible increased risk of suicide, especially for young people, as do all antidepressants since 2007. Pharmacodynamic. Dopamine is an essential chemical that occurs in many parts of the body. It is the premature degradation of dopamine that results in the symptoms of Parkinson's disease. Monoamine oxidase, MAO, is an enzyme which accelerates the breakdown of dopamine. Selegiline can prolong the effects of dopamine in the brain by preventing its breakdown through selectively blocking MAOB. It also may prevent the removal of dopamine between nerve endings and enhance release of dopamine from nerve cells. Mechanism of action. Although the mechanisms for Selegiline's beneficial action in the treatment of Parkinson's disease are not fully understood, the selective, irreversible inhibition of monoamine oxidase type B, MAOB, is thought to be of primary importance. MAOB is involved in the oxidative determination of dopamine in the brain. Selegiline binds to MAOB within the nigrostriatal pathways in the central nervous system, thus blocking microsomal metabolism of dopamine and enhancing the dopaminergic activity in the substantia nigra. Selegiline may also increase dopaminergic activity through mechanisms other than inhibition of MAO. At higher doses, Selegiline can also inhibit monoamine oxidase type A, MAOA, allowing it to be used for the treatment of depression. Half-life: 1.2 to 2 hours. Dose: Parkinson disease. Conventional: 5 mg PO at breakfast and 5 mg at lunch, 10 mg per day. After 2 to 3 days of Selegiline therapy, can begin to taper levodopa dose by 10 to 30% as tolerated, continue to taper based upon patient response. Not to exceed 10 mg per day. Orally disintegrating, with levodopa/carbidopa. Initial 1.25 mg PO q-day, may increase after 6 weeks if inadequate response, no more than 2.5 mg per day. Do not swallow. Taken in the morning before breakfast and without liquid, patient should avoid ingesting food or liquids for 5 minutes before and after taking medication. Safety advice. AUTGA pregnancy category B2, drugs, which have been taken by only a limited number of pregnant women and women of childbearing age, without an increase in the frequency of malformation or other direct or indirect harmful effects on the human fetus having been observed. That's all the information about Selegiline we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.